Hi everybody. So today we're going to be talking about fibroids. Fibroids. Everybody is asking about fibroids. I got an email the other day from a lady who wants to know about fibroids, and I thought I'd bring it to your attention. If you're interested, keep watching. This is Dr. Wanjiro Degwa, and you're watching Footsteps to Fertility. Today I want to assure women about fibroids because I've had a lot of scared patients and a lot of scared people coming to say, I have a little fibroid, it's gonna affect me. But no. I want to tell you that most women, actually probably 80% of women in our setup, have a little fibroid, and it's okay to have fibroids. A fibroid is a little growth that actually comes from the muscular layer of the uterus. And it's just an abnormal growth, not cancerous, that starts growing because of some cellular changes that happen. It grows usually inside the muscle, and it's just a muscular little ball of a fibroid. What are the symptoms, or how do I know that I have fibroids? If you have little fibroids that are maybe 1 or 2 that are 1 centimeter, most of the women will have no idea because usually they do nothing. But if you have fibroids that are all over, huge ones, the most common sign or symptom that you will get is heavy menstrual flow. So what's a heavy menstrual flow? If you're having your periods for a prolonged period of more than 5 days and you have to continuously change every 2 hours or every 3 hours, that's not normal. Most women in their menstrual flow amazingly just lose 80 mL of blood. It's not very easy to measure. But if you're having flows of over 150 mL of blood, then there is a problem. So the one thing that I want you to take away is that a heavy menstrual flow could indicate that you have fibroids. Another sign of fibroids is painful periods. Not for everybody, but some women who have fibroids in different areas, or where the fibroid is undergoing something we call degenerative changes, so meaning the blood supply is being changed, can have a lot of pain during their menstrual cycle. If you have huge fibroids, and some women can have fibroids that are actually the size of an actual 36-week baby, meaning a baby who's almost coming out. We've seen people who have big abdomens and all that's inside is fibroids. Those type of women will have urinary symptoms, meaning that you'll need to go to the toilet like every 5 minutes because it's pressing against your bladder. So if you have frequent urination, some women, because of the huge fibroids, will also have back pain or lower abdominal pain that is consistent. So those are some of the signs of fibroids. So the question that I know that all of you want to be answered is, do fibroids cause infertility? I'll answer that by saying yes and no. So let me explain. If you have fibroids over here, and over here, they have no effect on your fertility. But if you have a fibroid right inside the cavity, then yes, you will not be able to get pregnant. Because what happens is, remember, this little embryo lands right there. So if there's something obstructing it, it won't be able to implant. So the fibroids that are inside the cavity need to be removed for you to get a baby. And they're really very easily removed. Another thing, if there are too many fibroids, sometimes it may cause a miscarriage. Not really infertility, but miscarriage, because the baby may be here, and because of the many fibroids, you may have a lot of cramping in the uterus. And the cramping may cause 1, expulsion of the little baby. 2, the placenta is not able to attach wholly onto the surface of the inner cavity because of the many fibroids that are sucking all the blood, and therefore the placenta doesn't form well. And if the placenta doesn't form well, then the baby will be extracted later on. So fibroids can cause, but mostly do not have any basis on fertility. The last point is that if fibroids are over here and over here, right at the tube, the entrance of the tube, they will obstruct the sperm, they will obstruct the embryo coming in. So it depends largely on the size of the fibroids, where the fibroids are to determine whether they're going to affect your fertility. So, ladies, if you have fibroids, maybe 1 or 2, please don't worry. But if you're having excessive bleeding or the symptoms of pain and pressure, then you need to see a doctor. And if you're having infertility because of the fibroids, please see a reproductive medicine specialist. I hope I've answered your questions, ladies. If you feel the information on this video was helpful, please share. Please tell us what you think about it. Give us your comments down below. Feel free to email us or to call us. This is Dr. Wanjiro, and you're watching Footsteps to Fertility.